Hello, everyone, and welcome to the Anti-Doping Podcast, brought to you by the Partnership for Clean Competition. I'm your host, Dr. Marie McNeely, and today we are joined by our guest, John Travis. And listeners, John is the Certified for Sport Technical Manager at NSF. And today we are going to talk more about NSF, John's research there, and how he and his colleagues are working to protect clean sport through their certification programs and other efforts. So, John, welcome to our show today. How are you?
Thanks, Marie. I am great. It is a beautiful sunny day here in Ann Arbor, Michigan. Can't be happier.
Oh, I love it. Well, we've got some sunshine here in St. Louis as well, so I can't complain. And I'm looking forward to learning more about you and the wonderful work that you're doing there at NSF. So for our listeners who might not be familiar with the organization, can you just start by telling us a little bit more about NSF and its mission?
So NSF started out with humble beginnings back at the University of Michigan School of Public Health in 1944. So we've been around a while. We began by creating a public standard for certifying soda fountains, like the soda fountains you see at McDonald's where they fill your glasses with Coke and Pepsi and all of the fast food restaurants, what you see in the 7-Elevens, at the gas stations. In auspicious beginnings, all states in the Midwest area had different kinds of criteria for that they would accept for those soda fountains to be sold in their regulatory jurisdiction. And the manufacturers were having a hard time meeting the different requirements. So two public health officials from the University of Michigan and a regulator from the state of Ohio sat down and hammered out the first standard for soda fountains. So that's where we started in 1944.
That's wonderful. And you mentioned the organization was founded back in 1944, so you've got a long history. What are some of the key milestones, John, particularly maybe related to supplements in clean sport?
In 1999, NSF was approached by some supplement manufacturers to develop a consensus American national standard. We had worked with an organization called Amway. I'm sure your listeners or most listeners should be familiar with them. So they had engaged with us in a prior standard. So we also certify drinking water filtering units for residential and for small municipality use. So before we had developed that standard, there was all kinds of claims that these filter manufacturers were making. It would clear up their water, do this and that, slice their bread. I mean, it was all kind of outlandish claims.
Right.
And the EPA was preparing to step in to regulate that industry as a government body. And that is something that the industry did not want. So they took the opportunity to engage NSF to self-regulate and create a standard. Well, think back to the early days of dietary supplements, it's very similar. The analogies are almost identical. Wild, Wild West. We still hear that term thrown out for dietary supplements. So folks from Amway, some regulators from FDA, from NIH, a representative from NIST. So we had a vast array of folks that sat down in the room and discussed what the beginnings of an American national standard for dietary supplements would be. Now, it took us 2 years to get that done before we had our American national standard out. So that was 2001. Then 2004 is when we launched our Certified for Sport program. So we were approached by the National Football League in 2004. The Geyer report had just come out. So many of your listeners are probably familiar with that, but it was a seminal report on the preponderance of adulterated dietary supplements that could be purchased, whether online or brick and mortar stores. Within that report, they said something like 21% of products that were marketed as pro-hormones actually contained anabolic steroids, and 9.6% of products that were not listed as pro-hormones contained anabolic steroids. So those are some pretty high frequency rates. That report had come out. NFL was interested in what we had done for the dietary supplement industry with our American national standard and asked us to develop a standard to certify dietary supplements that were free of, and that was a term that was used back then, free of prohibited substances.
Definitely. Well, I'm glad that this was a step that the organization started taking, because I think this is a critical need in the field of anti-doping, but also in health more generally, to have safer standards surrounding these dietary supplements. And we mentioned that NSF is sort of handling everything from soda fountains, water filters, supplements. Can you talk a little bit more about the scope of the research analyses and testing that's done there at NSF?
We do have a very broad scope. Our official mission is to protect and enhance human health. This past year, our senior leadership team decided to expand that also to planetary health. So we also operate in the fields of sustainability and things like that are of interest to the human population to actually ensure that our planet exists a million years from now. So we operate in those fields. We do work in potable water systems delivery. So we have standards for direct additives for sanitizing water, for precipitating out waste particulates in water. We also test all and certify plumbing components. So anything that delivers potable water within U.S. households or from a municipality to a home has been certified by NSF. Sealants, plastic pipe, copper pipe, fluxes, you name it. Anything that touches water, we certify it. Food equipment as well. So all of our favorite restaurants that use grills, ovens, stoves, fryers, those are NSF certified to NSF standards.
Fantastic. Well, it sounds like such a wide range of different areas that you're working in. How does research work at the organization, or how does that fit into the bigger picture of all the things that you do?
It depends upon the area. So I will focus in on the research that we do for dietary supplements. A lot of what we do research-wise, especially with the Certified for Sport, one particular collaborator I've done a lot of work with is Dr. Peter Cohen. We have really wanted to bring attention to ingredients we considered that may have an impact on human health negatively. So we've gone out and looked for ingredients like that. And a lot of them actually would be considered doping ingredients. Our initial study that Peter and I worked together on was on the Craze product back in 2013 was our first study. Listeners probably remember this, but I'll give them a refresher. So there was a product called Craze from Driven Sports. I mean, it was a fantastic selling product. But what we had discovered in some of the blogs and forums and in our reading was that users were reporting effects that we thought were very similar to what one would see when folks were taking amphetamines or speed. We had done the testing on the product initially based upon how it was labeled. And at first, we didn't uncover anything that raised our eyebrows. But we continued to hear about those reports. And so we went back in and we did some more testing by using some different techniques. And it was really amazing that sophistication of what was in that product and how it was formulated. So they had listed on a label a number of phenylethylamines, and two in particular that they had listed that they claimed they had come from, or three from dendrobium. So one was just diethylphenylethylamine and N-ethylphenethylamine. So at that time, the phenethylamines were not on the WADA prohibited list. So they weren't really prohibited ingredients. The evidence that they had that we could uncover that those were actually in the dendrobium species, it didn't support that fact. So when we went back and did this further analysis, we actually uncovered that it was a methamphetamine analog. So it was N-ethyl, alpha-ethyl, phenylethylamine. So to make a long story short, it is just one carbon on two of the chains longer than methamphetamine. So it should act like methamphetamine, maybe slightly less potent, but it was being placed in dietary supplements without any kind of oversight. That was our first study together. And we have done a number of studies on different ingredients since then, from oxylifrene. I didn't do one with DMA with Peter, but I did some work with Dr. Krista Austin she worked for USA Armed Forces, maybe University Services. And we did a study on DMAA, done studies on DMBA. So Peter and I did that 1,3-dimethylbutylamine, again, another prohibited substance. And be on the lookout in the near future because we should have another study come out soon.
Well, that's exciting. And I know you've been doing research at NSF for quite a while, for over 25 years, actually. You worked in the position as senior research scientist there. So can you talk a little bit about your responsibilities? What did the day-to-day look like for you in that position?
My career at NSF has really evolved from when I started. When I started 28 years ago, I was working in extraction labs, just doing tech work. And then that was in 95 when I started. Like I said before, we started the dietary supplements talks in 1999. Our chief technical officer at the time was looking for volunteers to assist with this activity that we're in. And I was pretty young at the time, and she was asking people, and I joked that I was the only one that wasn't paying attention and stood there while everyone else took a step back. And she said, "Hey, John, you want to do this?" Oh, sure.
Thanks for volunteering.
Yeah, thanks for volunteering. No, but in seriousness, I was interested in dietary supplements and in the analysis of them at the time. Mm-hmm. So I volunteered, and then over the years, when we first started doing the dietary supplement certification, we had not a lot of experience in testing dietary supplements. So 2001 is when the research began, learning how to test and develop methods to analyze dietary supplements in support of our certification.
Absolutely. And you touched on this a little bit earlier in our conversation, but just to kind of summarize, why was the Certified for Sport program created there? And what were some of these decision-making factors that went into deciding to go for it?
We knew there was a need. We had developed a relationship with the folks at NFL at the time. The first brand that came into that was EAS. So EAS was our first customer. It was just so interesting. And it was really just protein powders and their RTD protein shakes at the time. So it was very exciting, very interesting, very new. And it was some things I really like to do. So the folks that know me say that you really like to dig in and try to solve hard problems. And it is a challenge. I mean, analyzing dietary supplements for prohibited substances at the trace quantities we look for is a very challenging task.
Absolutely. And I know you work on a wide variety of different products. You mentioned specifically protein powder. There's these dietary supplements. Can you just talk about, if people are looking in a store or shopping online, what kinds of products on the market are commonly in this bucket of Certified for Sport and get this certification?
Anything that's a dietary supplement or some functional food is eligible to become certified. They just have to meet our criteria. But the ones we have in our program, we have multivitamins, we have creatine powders, we have, like I said, protein powders and RTD shakes, we have energy drinks, we have joint health products that have chondroitin and glucosamine in them, we have fish oil products. So anything that you see on the shelf, we have a pretty good coverage of the types of products that are on the market. Now, I will say this, that NSF has shied away from certifying products that really tout themselves as weight loss and the sexual wellness products. Now, I do think that there is a need there for a certification program and we may change that. So those types of products have traditionally been the ones that have been most adulterated when we see reports coming out of FDA from their tainted product database or they have the brands issue product recalls. It's mostly today for a weight loss product that's adulterated with sibutramine, which was the drug Meridia that was pulled from the market however many years ago due to an increased risk of cardiac events. And a lot of these sexual wellness products where they are actually adulterated with analogs of, or the drug itself of Viagra, Cialis, Tadalafil, and Levitra. I may have got a couple of trade names mixed up with the actual chemical names there, but I think that the listeners get my drift is that there is a need in those product categories because people want to buy them and use them. And I think that fits our public mission well. So we may move into that to actually certify products so people can actually buy something that's not adulterated if they want to use it.
Absolutely. I think that helps listeners understand just the wide range of projects that NSF works with in the Certified for Sport program. So if, for example, let's say, John, someone walks in and says, I have this product, I wanted to go through and get this NSF certification. What is that process that they have to go through to initially get that certification to begin with, and then maybe to maintain it over time?
My first response is it's not for the faint of heart because it is a rigorous process. So we describe our certification as we have 3 pillars to it. The first is the manufacturer for that product must be GMP certified. You cannot make a quality product if you do not have quality systems in place to be able to manufacture a product properly. So there's a standard. It's NSF ANSI 455-2. I'm going to throw out some acronyms, some numbers there. But that really, it is a standard with a set of criteria for evaluating the processes of a manufacturing facility for dietary supplements. So first, a manufacturer must be certified to that standard, and that is maintained with an audit on an annual basis. So that in perpetuity, annually, that's the frequency. And as long as the brand wishes to do that, we will offer that service. Next step is a product must go through, and this is product specific. So the product must go through our content certified program. So with content certified, it's really the moniker, what's on the labels, what's in the bottle. So we look at the label claims they make and we evaluate the product against those to make sure they meet those label claims. And additionally, with that, we make sure it does not have some of the other nasty contaminants. For instance, elements like mercury and lead, pathogenic microorganisms. No one wants to have E. coli or staph or salmonella in their product. So we test it for those. We look for, there's a class of compounds called aflatoxins. Our listeners may not be familiar with that. So those are byproducts of when a mold gets on a product and the mold's remediated. The molds release these hepatotoxic, liver toxic compounds that aren't removed during the remediation of the mold. So we make sure that the products aren't contaminated with those. And then we have some other specific things depending upon if product has glycerin. We look for diethylene glycol, fish oils, we look for PCB and PCB-like dioxins. So we have a number of different things that we look for. That's the second part of certification. So once a brand meets all those requirements and we evaluate against that, then they can have our contents certified mark. And finally is the topper. It's like the frosting on the cake is the certified for sport. I should say the content certified is evaluated annually. So we figure a combination of the GMP inspections annually and then a spot check to make sure they're making products like they say they are by doing the testing is a very strong evidence that they have their systems in control for making quality products. But then, like I said, the icing on the cake is the sort of certified for sport where we test on a lot by lot basis products are seeking certification for over 290 different prohibited substances. So the anti-doping folks know that are listening here, and folks that aren't anti-doping folks, maybe this would be eye-opening. I think that people be astonished at the breadth of substances that are used for doping. And they're different chemical qualities and different chemical properties. Anything from we have substances that are very water soluble. So for instance, one substance, octopamine, it's very water soluble. It behaves both like an acid and like a base. So it behaves like vinegar. So vinegar is an acid, but it also behaves like ammonia. So if you have ammonia smelling salts, that's ammonia. So it has both those qualities. So it makes it a challenge to analyze. It's very water soluble. And then we have other compounds that are very fat and oil soluble. For instance, testosterone or some other derivatives of anabolic steroids are all very fat soluble. So, and then you have everything in between. So it does make for an interesting challenge, especially in the supplement matrices, to be able to measure and detect those compounds.
Absolutely. And just the sheer volume of them, you mentioned 290 different prohibited substances that you guys are testing for. So let's say hypothetically this product gets introduced to you. They say they want to go through the process. They get green lights all the way. What is the fastest time that a product could make it through this whole process?
It doesn't happen because any process, there are missteps and miscommunications along the way. And it's human nature. People will let things sit and like that. If everyone's on the ball, surprisingly, what takes the longest is the communications and paperwork transition between NSF and the brand. You would think that would be the easiest thing because that's just moving paper, but communications is hard. People, I think, underestimate how difficult good communications are, but that is really the key to what we do is us, NSF, having a good relationship with the brands that are becoming certified and communicating effectively to get it all done. That said, probably 3 months would be the fastest. I know we've done some faster than that. I think the fastest we've ever done is 2 months.
That's a tremendous amount of work, though, to complete within 2 months. And like you said, all the players have to be on the ball, responding quickly, moving things through the pipeline. So that is remarkable.
Right. So in order for us to assess that product, Marie, we need the product formulation. So we share that as confidential business information. And you can imagine first interacting with the customer and then being required to share that. So that takes a little bit of time to get that trust built up. We have all the agreements in place, so works out. But then, it just one always encounters something unexpected, and it's how you handle that through communications.
Absolutely. I'm sure it keeps the job interesting. So can you tell us a little bit more, John, about what you do in your current position as the Certified for Sports Technical Manager? What does this role entail?
I do a lot of what I'm doing right now, a lot of talking to people. It's just kind of funny. So, one of my favorite parts of my job right now is communicating and telling the NSF story and telling about what our value and benefit is and how we protect not only athletes, but consumers from giving them access to supplements that have been evaluated and verified as not adulterated, contaminated, and are what they say they are. So that is probably one of my favorite things to do right now. But I mean, like every position at a company, you have your administrative tasks. You have things you probably don't like to do. I mean, like everyone else, I have to fill out a stinking timesheet every day. But
I think no matter what kind of line of work you're in, there's still these mundane tasks that everybody just has to struggle through.
Exactly.
And you talked a little bit about just some of the different ingredients, contaminants, and substances that you screen for in these products. What does that process look like in a little bit more detail? Is it you just have pure isolates of the product that you're kind of running through all these different mass spectrometers, or what does that process look like on the lab side of things?
I'm impressed. Mass spectrometer. Where you go, Marie?
Thank you.
I'll describe a little bit about how we test. So because of the vast variety of chemical nature of the substances, we actually have 5 different extraction techniques that we use, and we run 8 different instrumental analyses to cover that 290 different substances. So I want folks to think about that. I mean, in the anti-doping world, yes, you do something similar. But when we talk to customers and they ask us, well, why does it take so long? And of course, everyone always says, well, why is it so expensive? We're always so expensive. Then we explain to them, okay, this is what we do. We have 5 different extractions. So we take your product and we subsample from it and we do 5 different preparations on it. And also when we do each of those preparations is done in duplicate. And we fortify all the substances for which we're screening into one of those duplicates at our detection level. And the reason why we do that is it gives us good evidence that we have a positive control, knowing that our methods of control, when we see that substance, when it gives us that signal during that analysis, we see that signal. And then on the one that's not spiked, that's what we're looking for, absence of that signal. So the comparison of the two it gives us very powerful evidence that something is either there or it's not there. And we do use all the flavors of mass spectrometry. For instance, for most of the anabolic steroids, we're using a GC tandem quadrupole. Everything else is done by LC tandem quadrupole. We do a class of compounds called the growth hormone releasing peptides. We do that by the Q Exactive. So that is a quadrupole with the Orbitrap on the back end. And then we're developing some other methods on that Q Exactive too, trying to do more of a untargeted screening to see if that works to allow us to mine for new substances as we see them arrive.
Absolutely. And we touched on this a little bit, that it is just a rigorous process that these products have to go through. So in your experience, it sounds like things fail. Things don't always go smoothly. So do products fail frequently, or do you have a sense of what the proportion of success versus failure is? And if so, do you know what some of the more common reasons are why products fail the certification process?
Yeah. And the first 16 years of the program probably had only 4 failures. So brands that were coming in, that it's not inexpensive, that whole process. And it is a lot of work and effort. I would say that all of the brands that are submitting products are the highest quality brands on the market. I mean, that is a significant investment for them. And no one wants to make that kind of investment to see a failure on the back end as your outcome. But it still does happen. In some of the first ones, I remember there was a product that had a polyphenolic extract that we found ephedrine and pseudoephedrine in it. There was a multivitamin that had morphine in it. And then there was another multivitamin that had THC in it. And this was when the THC criteria for water was very strict and cannabis wasn't ubiquitous throughout North America and even parts of Europe. So they were a surprise to us. And some of the things that we did learn is that, so with the THC, there was an ingredient called evening primrose oil that was manufactured in Canada. It takes the evening primrose seeds. They're high in a couple of monounsaturated fatty acids. So when they make seed oils, they press the seed and the oil is expelled out and they collect it. Well, come to find out, the processor also processed hemp seed for the same reasons for the hemp seed oil. Cross-contamination there. The morphine, the manufacturer also processed poppy seeds. So it was like Seinfeld.
Well, it's probably sort of helpful for these companies. Like you said, it's not your back alley companies that are going through this process. It is reputable, strong brands that are probably wanting to know if there's a problem with any of their products. So I think it's helpful for them to at least get that information that there might be a cross-contamination issue or some other problem in their manufacturing process.
Yeah, exactly.
So what happens then? You have to give a company some bad news here. Their product has failed. What happens next?
Yeah, that's probably my least favorite part. The initial talk. It's like talking to a child. It's like talking to a teenager that has gotten in trouble, that's come home at 3:00 in the morning kind of talk. Mm-hmm. They didn't mean to do it. They probably had no idea, or maybe they did have an idea. I don't know. But they didn't know it was bad, but you still got to have the talk. That is the test of the relationship. Then one gets to the bottom of why it happened and they figure out, and then they set appropriate control so it doesn't happen again. Now that product doesn't get certified. That's something that we don't do. And then we, depending upon what the substance is, the brand will, in most cases, destroys the product. Now, there are some substances, for instance, phenylethylamines. They're ubiquitous in the food supply. There are a lot of fermented products that where the bacteria will create these phenylethylamines as metabolic byproducts. They are prohibited in sport at high enough levels that we don't permit them in our program. So if we detect them above, and I don't have the level in front of me, but there's certain concentrations like that. But at lower concentrations, they're not a risk. So we don't require brands to destroy a product like that. They can just not certify it for sport, and then it's of no danger to the general consumer for them to consume it. So they will choose to do that.
That makes sense. So then if a product fails, are they allowed to sort of fix things, go through remediation and try to certify it again? Or is that sort of one strike and you're out?
That particular lot of product for the certified for sport can be certified for sport again. I don't believe no manufacturer's ever tried to do that. And I think they realize that it's physically impossible to remediate a product like that.
That makes sense. So how then, we talked a little bit about some of the research that you're doing there at NSF, and just, we all know that the field of anti-doping is an ever evolving landscape here. So how does NSF incorporate new anti-doping research and findings to ensure that Certified for Sport is really staying up to date with all of these changes, with the new substances that are being developed and coming out?
There's a few things. So follow a lot of the drug development peer-reviewed journals where they talk about, especially there's some really good ones out there like cell metabolism. Those two talk about a lot of developments in some of the pharmacology and different targets. Like, let's say a pharmaceutical company's working on drugs for sarcopenia, which is muscle wasting. A lot of those could be considered prohibited because they build muscle without the benefit of any of the exercise or training. So that's one of the criteria. They're performance enhancing. That's one of the criteria to get on the WADA prohibited list. So we follow those journals, and I know that the anti-doping labs and WADA does that too. So we follow that. The other interesting thing that I follow is looking at the forums on these different supplement sales sites, whether it used to be bodybuilding.com. There are other sites now that review. I follow the forums. That was a good source initially back in the early 2010 to 2015, 2016. It's a good source of information for our targets for studies for people who are doing things that they shouldn't be doing. But it's got a little more quiet now. I think that I'm not a social media guru by any stretch of the imagination, but I think I'm going to have to learn Instagram and some of these other places where they're actually marketing some of these products to understand what's being sold right now.
Absolutely. So once you identify a compound of interest, what then does the research stage look like? Or how do you incorporate these findings or these new directions into the general daily processes at NSF?
So all labs do some kind of what's called method validation and method development. So we'll look at the substance, examine its functional groups, its structure, look at potential pKa that's reported in the literature, things of that nature. And our best guess as to which of our current methods we're using, it may work. Then we'll do some proof of concept work to see, okay, this is our guess. Do we get a detection of it? Then we place it within the method, and then we do our method validation. And this is something I think that we do that is very good that I don't know if everyone does in the supplement realm for testing. So for our method validation, we set that up to look at 85 products. We do those in duplicate. And just like we did, like I described for our routine testing, one of the duplicates is fortified with that substance at our targeted threshold, whatever that ends up being. That's really determined by the class of the substance and actually how easy it is to detect it or how difficult it is to detect it, however you wish to look at it. And then we do 85 products blank that will not have that material. So what we're looking at is the blanks that don't have that substance should all be negative. So we look at the probability of finding a true negative, and those are true negatives. So while your method would 20% of the time call this peak substance X, but it's not substance X. So we're looking to keep the number of false positives down by doing that. Then conversely, when we do the method validation on the ones that are fortified with that substance, those are true positives. We want to make sure we don't have any false negatives. So we try to keep the false negative rate below 10%.
That makes sense. And I think one of the things that makes anti-doping really exciting to work in is just how collaborative it is and how international it is. So can you talk a little bit about how NSF works with or maybe collaborates with different partners in anti-doping, whether that's the PCC or others in the community?
Yeah, that's something that I hope to bring more to the forefront. That's something we haven't done a lot of, to be honest with you. We talk with the leagues, we talk with PCC, we interact with them, but on research basis, it's not something we've done. And I think that that's something we need to engage more with. I do know one thing we would like to do, and I do see that I have talked with folks before. There's a couple of research projects that I wanted to get off the ground. One of them was some follow-up studies. So Dr. Mario Tavis from Cologne has done a couple of studies with microdosing, one for enobosarm or ostarine, and one for ligandrol, which is also known as LGD 4033. So he'd done microdosing down to like 1 microgram per serving for an athlete or for a consumer and looking at the excretion profile of those substances. Now, what we have learned in our analysis of dietary supplements is when we see something in a supplement, we consider that a high amount. When we detect something in some of those failures, like I was talking about with THC or ephedrine, those were in the nanogram quantities. So one thing I would like to know is if we extend that down further, let's say we go 200 times less, down to 50 nanograms, from 1 microgram to 50 nanograms, can that still be detected in urine? So that would tell us, I would like to learn if what we're doing is good enough as far as our detection limits and supplements, or if we need to go lower, or if we are just really being too restrictive and that doesn't even perturb, it's not even detected. So to detect substances at low quantities, it's challenging, and challenging makes it more expensive. So are we, for no value, causing the dietary supplements manufacturers more money to get this more sensitive testing? So that's something that I would like to know.
Absolutely. And I think that's a really good point that you brought up there, John, is that you are kind of operating within this company environment where you're providing a service to these companies that are hoping to get their products certified. So you do have to kind of balance that. What is the expense that they're going to have to cover to get through this process, to also kind of balance against ensuring that you're being sufficiently rigorous to catch the things you should be catching?
Yeah, you hit the nail on the head. That it's a balancing act.
And I know we talked about how you're engaging in research and kind of there's a lot of different directions that you can go. I know things are constantly in flux in anti-doping, but what are some of the scientific priorities right now for NSF? You mentioned this one particular project that you're interested in, but are there others that NSF as a whole is interested in pursuing related to supplements and anti-doping?
Yeah, we're always looking to expand our coverage of the prohibited substances. Previously, I described what our validation process is. I mean, 85 products going through the analyses in duplicate. That's a lot of work. So we're always looking to expand. I'd like to expand our coverage of the class of SARMs to get some more of these SARMs that have been published in the patent literature on test and get them within our program. And there are some other categories of prohibited substances we have not done a good job of creating methods and screening for. Corticosteroids and HIF stabilizers. The corticosteroids have been around for a while, and we just have not addressed those sufficiently to my taste. And then the HIF stabilizers are new class of substances that the folks that are listening, they cause the body to, and it's an hypoxia. So it produces more red blood cells, more hematocrit. And so it improves the endurance of people that are consuming them. So those would be a fantastic category to give a benefit for our endurance community to make sure that they are served as well.
Absolutely. It sounds like there are a lot of different directions you would like to take the research and development there at NSF, but I know you've had many successes over the years as well. We love to celebrate these with guests and with our listeners. So do you have a favorite success story, something that you've achieved there that you'd like to tell us more about?
It's that first story I was telling you about, the craze, because that was the first real research project that I published with Peter and Dr. Bastian Van Huys, who works in RIVM in the Netherlands. That was my favorite one. Your first is your favorite. So, right. But that was the first one. That was my first cease and desist letter. So I got a cease and desist in the US, and then I got a cease and desist from the UK as well, which was surprising. So some of the folks that are listening to this remember UK Anti-Doping used to put out a conference. Now, this was in 2012, 2013 where I got that. That was right around the time when UK was putting on its conferences. And I was scheduled to go over there for the first time. And I was wondering, it's like, well, how does a cease and desist letter work in the UK? Is it same as in the US? Right. They're going to flag my passport so when I get off the plane, Bobby's there with the billy clubs and the hats looking for me? I didn't know.
So did it all end smoothly?
Yeah, I was worried for nothing. Sometimes you get in your own head with these things. So actually, I still have both of those cease and desist letters.
Yeah, and I think that's a really important point to make as well, that anti-doping kind of brings all of these different fields together, whether it's science, sports, the legal side of things is often a big challenge as well. So was it difficult for you, having the scientific background to start to have to get into the muddy waters of the legal world?
It was definitely different. And learning to talk and articulate your point in a way to folks that don't have the knowledge of anti-doping or just analytical chemistry in general. Being able to articulate that message is a learned skill. I will say that.
Absolutely. So can you tell us then the success story? You said that things ended smoothly, things went well. This is your favorite success. What was the sort of ultimate outcome of it?
So we were able to have that product removed from the market. So folks were not exposed to this methamphetamine analog unbeknownst to them, everyone knows about the health harms that have been done by methamphetamine, and people become addicted to it. And the addiction potential had never been studied for this substance, but yet it was still in supplements. So I think that's being out of everything with this, getting that product off the market to protect consumers is the thing I'm most proud of.
Definitely a win for protecting the broader public health. So congratulations on that success. And apparently it got you hooked on the field because you haven't left. It didn't scare you away.
Yeah, no, it didn't scare me away. It's amazing, though, when we published the paper, how many contradictory ideas came out about it. It's like, well, you misidentified it as this substance. Went through, it's like, nah, no, we didn't. And this is the reason why. Oh, no, it's a fake product because this label looks like this and it should look like this. Like, yes, that's possible, but it's more plausible that your quality control of your label manufacturer was off. And so the color was a little bit off there. So that's equally possible, if not more plausible explanation. So all of these red herrings were thrown out about either the material we tested wasn't authentic or we didn't know what we were doing and didn't identify the compound correctly. It was just amazing how many of these roadblocks were thrown up. And we see this in every field today.
Absolutely. And I think just being able to do the science, have the research, have the data to back up your claims, I think is so critical. And you've been answering some really interesting questions in science and solving some big problems there. But I imagine that even at NSF, you have roadblocks, things that hold you back, and maybe limitations in resources, time, funding, staff, whatever it might be that prevent you from being able to do absolutely everything, John. So if we gave you all of the resources you could possibly need, is there one particular problem in anti-doping or the supplement world that you would want to solve most?
Wow. I've been thinking about this kind of question for a long time now. So one thing, it would be fantastic to have an assay where researcher could identify the activity of a product or the material you're testing, or it's a little more difficult for anti-doping researchers doing the human biologics because you're going to have metabolites of some of these things are in the human body, so you could do it. But I'm thinking more of the supplement realm, have some kind of assay that would evaluate the anabolic potential of a product. So instead of going through and doing a targeted analysis for 50, 60 anabolic steroids, have an assay that works that could tell you if a product has anabolic activity and do that in a cost-effective manner so that we could actually test more products so more athletes and consumers would be safe.
Definitely. I think the potential for these kind of more non-specific tests are tremendous in terms of the ability to save time, money, staff, and all of these resources that are limited at the moment.
Yeah, because then if there's no anabolic activity, there's no sense doing the more expensive tests. Then you can focus on your attention on the ones that do have a positive to learn, is it a false positive or a true positive? So then you can move your good things through quick.
Absolutely. Well, thank you for giving me and our listeners a lot to think about today, John. If we want to learn more about you and the wonderful work that you're doing at NSF, what is the best way to do so?
I'll give you 3 resources. So one is www.nsf.org. That's our main website. It has information about all of our service offerings for public health, the water, the food equipment, the sustainability. That's all listed there, and you can read more if you're interested. Then the sport specific part is nsfsport.com. Has a listing of our certified products. Since I'm pretty new to this role, I haven't done a lot with updating that site. One thing I really want to do is do some more white papers and opinion papers that are published on that site, trying to provoke thinking and ideas and get feedback from our brands and from folks that visit the site. And then lastly, like I said before, one of my favorite parts is talking about NSF and what I've done and what we do and what we plan to do in the future. So folks can just reach out to me through email at travis@nsf.org and contact me that way with any questions or comments or criticisms.
You're open to it all. I like it.
Yes.
Well, John, that sounds great. Listeners, definitely check out these websites to learn more. And John, thank you so much for joining us today and sharing some of your insights and experiences.
Oh, thank you, Marie. Thank you, PCC, for inviting me to do this. I really enjoyed my time here today.
Well, it has been a pleasure to chat with you and to learn from you today. Listeners, it's been great to have you here with us as well. And if you haven't already, it would mean a lot to all of us if you could rate our podcast and leave a review on your favorite podcast platform. And listeners, please note that the Anti-Doping Podcast features a wide variety of clean sport experts, and episodes may include statements and or viewpoints that do not necessarily reflect the views or values of the PCC. Thank you, and we look forward to seeing you on the next episode of the Anti-Doping Podcast.